Hello and welcome everyone. I'm really excited to welcome you this afternoon to our Cochlear Center Research Day and our talk by our guest, Dr. Malaz Boustani, on the Agile Change Conductor. So just quickly before we get started, a couple of logistics. So we will have questions and answers at the end of the presentation. For those of you in the room, we ask that you please use a microphone so that we can make sure that everyone who is online can hear your question as well. And if you are online, if you would please use the Q&A feature, and then we will be happy to ask your questions on your behalf. Just to let everyone know, this seminar is being recorded. We do have transcription services available, and so closed captioning is provided. We are also providing the link here if you would like to access the transcript. And if you have any technical difficulties, please reach out to us at jhcochlearcenter@jhu.edu. So this, I think, is always one of the absolutely best days of the year. We have a really great agenda, starting with our keynote address right now. We're going to follow that with lunch in Finestone Hall, so we hope that all of you can join us for that. And then at 2 o'clock, we'll have a poster session as well. And so we have 10 amazing posters by 9 amazing trainees to kind of showcase and highlight all the great work that they've been doing this year. And so with that, I'm really pleased to introduce our guest speaker, Dr. Malaz Boustani. So Dr. Boustani is the Richard M. Fairbanks Professor of Aging Research and Medicine at Indiana University. He is the founding director and implementation scientist at the Center for Health Innovation and Implementation Science. He's also the founding director and chief innovation and implementation officer at the Sandra Eskenazi Center for Brain Care Innovation. Dr. Boustani earned his MD from the University of Damascus in Syria. He completed his residency in internal medicine at Case Western University and received his MPH and completed a geriatric medicine fellowship at UNC Chapel Hill. So Dr. Boustani is a geriatrician, he's a neuroscientist, he's an implementation scientist. His goal is really to take insights from behavioral economics, complexity science, and network science to develop, implement, and distribute innovative, sustainable, and scalable medical innovations to deliver personalized, evidence-based, and valued healthcare. And I know we're going to hear a lot about his programs to do that today. If you have the chance to look at his very impressive CV, you'll see a lot of things stand out. So there's a lot of history of grant funding, as well as a lot of publications, over 250. But what really stands out, and I know what we'll be hearing about today, is the impact that Dr. Boustani has had on mentors and trainees he's had the ability to work with. And so to give a little bit more of a personal introduction, we want to turn it over now to Dr. Nick Reed, who is one of Dr. Boustani's mentees. And unfortunately, Dr. Reed was not able to join us today, but he went ahead and created this recording for us.
Hi, everyone. I'm sorry I couldn't be there today. I foolishly double booked myself to give a talk in Pittsburgh the same day as Research Day. You've heard a little bit about Dr. Boustani already from a high-level introduction. You know that he's a geriatrician, a neuroscientist, an implementation scientist. You know he has hundreds of publications and millions in grants. And you know that he's given us key insights into delirium and dementia, including the risk interaction for delirium and dementia biomarkers, scalable collaborative care models for dementia, and actionable insights into rural versus urban models for dementia screening. But I'd like to go a little deeper with the introduction and talk about the Malaz Boustani that I know. I've known Malaz since 2017. It took me a second to think of this. He was a mentor of a mentor, and when I was putting together my K Award team, I flew to Indianapolis to meet with Dr. Boustani to ask him to be a part of my K Award. Very quickly, we hit it off. He offered me a job, actually, in a typical Malaz style. And we discussed my research, we discussed life, and the 2 or 3 hours that I was with him flew by. I thought that we had a special relationship, and we do, but I learned that that is not unique with Dr. Boustani. Malaz is one of these people that truly believes in translation science. A lot of people talk about translation science. We talk about the delay from research to bedside to patient care being 14 to 17 years. But Malaz is someone doing something about it. Not that others aren't, but Malaz is especially good at it. He founded the Center for Innovation and Implementation Science at Indiana University School of Medicine, which sounds like another stuffy center, but it's not. It is truly a unique collaborative space for people from various stages in their careers and various stages of academic medicine, public health, engineering, liberal arts sciences, communication sciences to come together and think about how to make a difference in people's lives. When the COVID pandemic hit, I decided to enroll in the graduate certificate for innovation implementation science. Not having much else to do at the moment, well, having plenty to do, but not a lot to focus on in my everyday work and life being disrupted. The graduate certificate program is unique. It has a lot of typical presentations and classroom style work, but Malaz makes it special by doing regular meetings with all of his students and having us even journal our weekly reactions. Some might groan and think that this is, it's another thing, but Malaz reads every journal and then has one-on-ones with you when he wants to discuss them further. He truly gives a ton of time in this space because I think he understands that for implementation and translation science to really take hold, we truly have to become messengers of our work, and he believes that he is the messenger of implementation science and creating, if you will, disciples of this who go out and push their work into the real world. He is generous with his time, and since doing the implementation and innovation certificate, I've continued to meet with Malaz regularly. During my K Award, of course, he helped with research, but he actually became a key confidant and mentor on career development, where we talked about planning, different options, different ways to go in my career. He is a safe space for anyone to talk to. I still attend a weekly group meeting. Not as often as I'd like. Kids prevent me from coming, but I still attend this, and I'm shocked that Malaz holds multiple weekly group meetings with former, quote-unquote, former mentees who come together and discuss research, career, and implementation science. This is somebody who, outside of his academic career, outside of his clinical career, outside of being a founder of multiple startups, is giving people time. I am extremely jealous that you're going to get to hear from Dr. Boustani today on his research. And not just because his research is brilliant, but because as a person, I think he is the kind of scientist that more of us should strive to be. Enjoy your time with him today. Thanks so much.
Thank you so much to Nick for that. Okay, and so with that, Dr. Boustani, I'd like to welcome you up. Thank you. Can you please help with slide changes, please?
Going downhill from here. You can live up to Nick. All right, so I'm gonna share with you the persona and behavior of people like Nick, okay? We call them Agile change conductors. So this is my disclosure. And then this is our why. It used to be just my why, but a lot of other people. I'm a physician and scientist in the same time. I still see patients every Monday from 8 to 1 p.m. And I still do research in the healthcare delivery system. And every single day I see patients or I do research, I see the consequences of delay in your research to stay on the bookshelf instead of make it to the clinical program, and every workaround that clinician do to kind of figure it out. there's always a human life suffering. Personally, my family were one of these victims, these human, because of the system could not manage them. My in-laws and a lot of my patients and even my colleagues. And just on the 26th of March, we lost giants in the delirium field who, despite all of his skills and resources, struggled navigating into this complex adaptive healthcare delivery system that we have in the United States. So I don't want you to forget that. I don't want you to make it an abstract. The patients cannot wait while the system protects itself. And when I'm going to argue with you, you are dealing with two species. One species is getting very, very big, and it's eating up the other species. So this is why we want you all to become an Agile change conductor. Please don't stop at writing a grant and getting it funded. And please don't stop on writing a paper and publish it in peer-review article. Make sure that's the start. And I'll try to tell you how maybe you can join a group of people who can help you, your support group. This is the scientific village that behind this Agile science and its derivative that I'll share with you. I'm going to go over a couple of people who are amazing. Two of them are not with us anymore. So let's see if I can. Okay, over here, this is Dr. Mary Ostrom. She's a giant in dementia caregiving. She died, unfortunately, before the pandemic with pancreatic cancer, much, much early than you will hope. But she left behind a lot of work that my father died 2 years ago at home, even though he was in Syria, because of her work. I was able to translate a lot of her tips and strategy to help my father. So hopefully she won't be forgotten. And then just last fall, we lost CU Hui, who was our senior biostatistician. She was like my mother, and she taught me about signal detections and be humble and figure out the limitation of your analytic methods and all the assumption that you build the tower on. Then the rest are still alive, so that's a good one. All of them have been my mentor, and now I'm being the mentee of a lot of other folks. So I'm going to tell you about Agile Science's derivative by primarily describing the Agile change conductor. I'll tell you then an Agile strategy. It's not a tool, it's not a process, it's very high level, but a lot of my mentee and my mentors really struggle with Agile strategy. So I'm going to give you that as an action. Sure. There's an echo?
Yeah, just a slight. Just need to turn down the lector mic just a little.
All right, you should be good. It's working out? Yeah. All right. So I'll, in order for me to tell you about Agile science, I'll focus on the Agile change conductor. And for the past 24 hours, I see a lot of Agile change conductor from the people that I met already. They just don't call themselves an Agile change conductor. So hopefully now I'm going to change your tag. Okay. And then I'll tell you, as I said, the Agile strategy. Then I'll focus on a specific unit of action in Agile science. We call it Agile cycle. And it's another typical improvement cycle, but has a very different initiative. And hopefully we'll open up for question and answer at the end. So this is Agile science. I'll read it to define it, tell you the purpose and the outcome of it. So Agile science, it's a process for that is very, very fast for knowledge discovery, knowledge acquisition, but within the dynamic, constantly changing, evolving real world. All right, it's constantly changing. Time, you can't just simply pause. So it's a very, very dynamic. There's a lot of loops. There's a lot of interactions. So that's what it's focused on. How can you solve a problem in that world? It brings insight from complexity science, network science, and behavioral economic to do like any other science does. Understand, predict, and then steer or control the behavior of two separate species. The one is each of us individually as a human being, and then the social organization that emerged from the conditional interaction we call social interaction for a large number of us, as small as a family and as large as the entire globe. Okay? These two species are connected the same way how you as a person is connected to yourself, but they are very, very different property. All right? And a lot of time when you try to do change, you get confused the property of these two species and you do a lot of transfer. So I can tell you a major one. How many of you kind of cursed a social organization by using the term, this social organization doesn't care about me? Raise your hand. Like, come on. Right? The whole issue, that social organization doesn't have a property of caring. That caring is an individual, a human being. Okay? The people say it's really an evil organization. That evil, that statement, it's not property of that social organization. All right? So a lot of that confusion between these two species that lead to barriers and problem in solving, trying to make the world a little bit better. So Agile science give you insight to develop from the beginning when you face a problem, put a constraint to develop scalable, effective, person-centered tools, processes, and strategy. And then think about simultaneously how you're going to implement them and diffuse them across the various social organizations that host that special species that we call individual human being. So our goal for us, at least since the 2010 or so, is trying to build the network of these Agile change conductor who have a strong foundation in Agile science and are masterful in Agile processes for innovation, implementation, diffusion, and now even signal detection, hopefully to transform healthcare for better for all now. There's a constraint of urgency. Our Agile change conductors see the suffering while you're waiting for your perfect solution. It's the number of people with unrecognized dementia who are receiving anticholinergic medication while you're waiting for the perfect one that will give you the best things. People are suffering, and in the area under the curve of that suffering, keep accumulating while you're waiting for the perfect solution. All right? So it make it visual, it make it see it, so you can do a good benefit harms evaluation, taking into account speed on that piece. Typical public health equation. I don't know if you know that equation, but the minute I went from being a doctor to being a public health, I saw that equation of impact, which is a product of four things: effect size of your solution, but it's implementability, scalability, and sustainability. And that's where I found out, for me, for example, unrecognized dementia is a big problem for us. We have around 50 to 80% of people with moderate level of dementia are recognized. The solution that a lot of my colleagues is an MRI or PET scan or CSF. They have a beautiful effect size if you define it by accuracy and stuff, but their implementability, it's terrible, all right? Our solution has been a solution that costs 0 minutes by any clinician and less than $1 per member per month. We put that up front in the beginning as a constraint to figure out what's the right solution to fix that problem of unrecognized dementia. So the persona of these Agile change conductor, we have 3 persona of them. One of them is the scientist, which is technically, for me, I'm more of that applied Agile scientist. So I'll start with that, but it also have leadership persona and then provider persona. These provider can be clinical provider, it could be also public health providers, all right? So as an Agile scientist, these persona for these Agile scientists, they are obsessed not just developing effective solution, but this implementability, scalability, sustainable one. They evaluate plan change in the dynamic, constantly changing world. They don't do, let's just put the world on hold, you know? And let's take a picture and then take a picture 5 years later, and let's compare these two pictures. It's constantly evolving, seeing how things are going. Then I'll move to the last, the first one is the C-suite officer. These are folks who want to become in the C-suite, specifically in healthcare delivery, like chief medical officer, chief executive officer, chief nursing officer, chief operating officer. And these persona are very weird. They are passionate about making a profound and lasting difference in the value of the healthcare services delivered by their organization. Yes, they still exist, despite whatever. I married one of them. I just want to let you know. I found my wife. She was running a healthcare system as a CEO. And as a doctor, we hate administrator. I don't know if you know it. We hate them. Cool. And then I fell in love with her, and I saw, oh my gosh, she worked harder than me. She's on call like 24/7. All right. And so I learned like, no, that's different. And then they are trying to determine to make a difference, but they are very frustrated with their current tools that they have. And they became even a skeptic. And then in the middle, the persona of the practicing healthcare professional and public health professional, they are still passionate. And you can see the word passion across. You don't see it in the applied scientists, because most scientists trying to depassionize themselves for whatever reason. They think objectivity, it means depassion, all right, for a way to reduce biases. But these practitioners are also passionate. They're trying to make a profound and value, but they are paralyzed. They don't know how to do it. They don't have resources anymore. Their voice is being shrinking, all right, in their influence. These are the agile change conductor persona that we're trying to provide them with tool processing strategies so they can follow their passion of making the world a little bit better. And these agile change conductor are different from the typical thing. They are very, very action-oriented people, meaning they are more like an engineer than lawyer, right? They really are action-oriented. And they are able, if they reach enough skills, to recruit and retain and lead large number of human, because most of their problem, they can't solve it on their own. I cannot, go to the moon on my own. I need an entire civilization over time to reach that level. And they want to solve problem in the healthcare system or any other social organization, but they are pragmatic. They know you can't solve the problem with this concept that is very, very common in Western way. Imagine, Malaz, you have unlimited resources. Go and fix the unrecognized dementia. So what do? Oh, I'm very cool with innovation. I want a PET scan because it's cool. It's making me really nice color. The precision is very, very small. So this is why it's very important when you try to solve a problem, you put constraint on it. And that constraint is not just time and money capital, but also social capital and an anxiety capital. I'll mention that more. And this is the hardest thing to sell to people who are not a scientist, is in order for you to solve a problem, you need to collect data and reflect on it, all right? And that type of data is trying to tell you how to figure out signal noise through surveillance, cause and effect, so you can make sure you're not spending your money on something that doesn't work, and then ideally predict and forecast the future. This is the agile change conductor. They act like an engineer, scientist, psychologist, and an artist. In certain circumstances, they act more like an engineer. In other contexts, they are more like an artist. And the best agile change conductor are multilinguistic. They have the property of these 4-1. But you don't need to be masterful in all of them. Sometimes, at least you need to be masterful in one, and then really fluent in another one, and able to understand the other two. Okay? And this is the big thing for them. That takes time for us to work on it. I met with some of the amazing future leaders and scientists today at 8:15 or 8:30. And what I found there, like everywhere else, most of us don't know and they don't share their why. Okay? They are almost on automatic side. And they raise capital, not just financial capital, but social capital and anxiety capital. they select or develop tools, processing strategy to change the behavior of these two species. The one human on one side and the social organization that emerge with them. They constantly collect data and reflect. And this is their behavior. If you watch them and not just ask them survey question and tell them what they want to be, if you just look at their behavior, because that's where you can see the action, they are doing a lot more than planning. Okay? They are learning by doing. It's almost like athlete. They deliberately practice. It's almost like surgeon and doctor. I did not learn how to put like central line by reading a book and memorizing. I learned it by doing it there, and somebody in front of me tell me, "Oh no, come back over." Cool. So that's doing, learning from doing. They conduct rapid, what we call minimally viable experiment or sprints. They live. It's all of their secret is how good is their network in capturing or building these feedback loop. And these feedback loop that are set up for a human. So they're not just timely and accurate and actionable, but the big one, the hardest thing to do for feedback is non-judgmental feedback. And I can't tell you how hard it is to deliver non-judgmental feedback and receive non-judgmental by a human. And I can tell you in the past 10 years, there's been a lot of confusion in the psychological safety between nice and kind. All right? And in an epidemiology terminology, kind is you give accurate information with minimum false positive and false negative. Nice, it's you give them a false positive and true positive. You don't give them any negative. All right. So imagine what happened if you give somebody just positive feedback, meaning false positive and true positive. They get an amplification of the wrong things. So please be kind, be careful, obviously, but be kind and give the truth, at least from your perspective, with an asterisk. Okay. They do a lot of networking, not just for research. So they're not efficiency oriented only. They do a lot of networking to leverage this diversity among humans. So for me until now, every time I'm on a plane, whoever sit by me, I try to talk with them. Always, always, always. Every time I try to do that as much as possible. They questioning constantly, and their question is not like how question, it are more like we call them expansion question. Why not? All right. What if? Okay. And they observe not just with one sensors. They observe everything. Like right now, for example, I know one of you is doing this and looking like that. Correct. And I know that somebody was taking a picture, and somebody did this. All these kind of things. People, oh no, he did this one now. Cool. So it's sending me a lot of information to improvise and hedge and figure this out. Okay. And then they are scientists. And what is scientists? Skeptic, but not paralyzing, judgmental skeptics. Okay, that's very, very different. And most of us, at least I try to make them more Bayesian, Bayes, not Fisher. I hate Fisher, so just FYI, that's my bias. So I like the Bayesian, the update, the constant update, correct? Make your assumption, you update, you change that. And they usually get ready to harvest luck when it hits, okay? And this is how we produce the Agile Change Conductor. We over 12 months through the graduate certificate, at least the beginning, we introduce them to Agile science. We try to work with them on obtaining an Agile mindset. And then we focus on the Agile cycle and all the Agile processes like we have developed so far. And we don't stop there. We know in a human, you need to become a great storyteller. You need to become a nudger and signal detector together. And if you can't be that way, then you have to outsource it to somebody else. Okay? And I don't know what you're doing if you're watching the news, but right now what's going on in the news is two stories fighting each other, right? Just to let you know. And a year ago, there was another two stories. Always story fighting another stories. And then you cannot stop there. You're going to have to work on your brand so people know about you so they can invite you. And one thing one of our speakers remind us of this is not about who you know. It's about who knows you. So you saw that. I didn't know any of you, but Nick knows me. And because of that, he brought me here. All right? It wasn't my CV, just FYI. Okay? My CV, if you look at John Hopkins, it's not that. I'm like small fish in your pond. And then finally, you become a strategist in Conductors. So I gave you more kind of in the background. I'm more than happy to answer any question, but let me give you a little bit of action. It's not a tool. It's not a process. It's more high level, okay? So imagine in order for you, what is the Agile strategy after you know your minimally viable goal? So first is you need to know your goal, but don't make it perfect. And I'll explain this word minimally viable in the next couple of slides. So you set your goal, you figure out what's the capital you need to execute your goal based on what you know right now. You find out what's the demand, okay? And I'll highlight this demand in the next maybe 3 or 4 slides. Demand is very different terminology that I'll explain to you a little bit more. And then based on that, your goal, you decide, all right, what is the first version of minimally viable activity that will make me close to get that goal? And then if you can't do your goal on your own, then you're going to have to recruit the minimally viable number of people who are going to do with you or under your supervision these daily activity. And then don't make the assumption with all your planning that first version of your daily activity was perfect and I'll see you in 10 years because I forecast it's going to take 10 years of me running this daily activity to accomplish my goal. It's not going to work. Your first version is not going to work. All right? And therefore, you need to create this what we call minimally viable dashboard. Don't give me dashboard that will consume all the energy, that I will have no energy left to run the daily activity because most of my capital is spent on data collection. Use the minimally viable dashboard to give you that feedback, and don't do dashboard if you don't allocate time for you to look at the dashboard and reflect on. I can tell you in the C-suite, there's so much dashboard. Nobody has time to even think about it individually or together, okay? So that's our Agile strategy. Then I'll highlight a couple of things that's unique for it. So let's start with the minimally viability that you saw all across the dimension. So when I say minimally viable goal, it's the smallest goal that still matters to you or to the organization. Solution, the minimally viable solution is the simplest version that works. Effort is the least activity that create learning. Team, the fewest people needed to execute. And metrics is the minimal dashboard that guide decision. All right, so each step stay intentionally, not because you're lazy. It's intentionally small, and it's so hard to do small. How many of you write grants? How many of you write paper? How many of you don't like it when somebody say, shrink your paper to 1,000? Because it requires a lot of work. Cool? A lot of work. Okay? So just because you said minimally viable doesn't mean like, whoa, I'm doing it, taking it easy, it's low quality. It's the opposite. Okay? Math, technically, it's all about that. All right? You explain the world through one equation or one simple symbols. And viable and minimal, I'm giving you even more for it. So viable, solve a real problem, can be used in practice, not just theorized, produce feedback, give you some data. And then minimal, use the fewest feature, avoid polish optimization, and focus only on core assumption that you need to test. Okay, so that's what I mean about minimal viability. You saw it across all the dimensions. And then finally, this is a little bit complicated. This is more for the C-suite. So most of my scholar move on and they become like a leader in the healthcare delivery system or other companies. And their biggest struggle right now is make a strategic goal, okay? So this one is simple. If you are an EPI, this is like 3 vector, you know, it's not that complicated. But simply what they try to figure out is trying to use any kind of goal. They put it on binary, low or high on 3 dimensions: the demand, the energy cost, and the time cost. And based on that cube, you create a cube with 8 kind of category. Like this is a simple one. And your goal as a strategist is to know where is your goal sit on these zone. So if you are picking up a goal in the dead zone where it's nobody care about it, it's going to cost a lot of energy and cost a lot of time. This is like, you won't bet on it, okay? Except if you intentionally say, this is what we want. And this is what happened in 1960 with the president of the United States when he said the moonshot, correct? He knew that was a dead zone, but he used it to captivate and motivate a nation to go after that. Now, if your goal is in the green zone, stay away. Don't try to add another bureaucracy, another thing. This one has a high demand, low cost, it takes low time. Your job is to make sure nothing stay in that because it will go on autopilot very, very quickly. And then the rest is somewhere between these 2 fields. So then the last couple of slides, I'll tell you about the term capital. That's very, very relevant for you, okay? So all of us are equal on time capital. To the best of my knowledge, raise your hand if you find out, there's no human being who can have more than 24 hours a day. Have you found anybody who has more than 24 hours a day? To the best of my knowledge. So you always have that time capital. What you can vary on it is the output per capita. There's one group of people who can produce thousands of paper in 1 hour, and one group of people they can produce 500 sentences, or just a couple of sentences per hour. That's an opportunity for optimization. Okay, so that's the time capital. It's the least scalable capital. Is the one that you have to protect and engineer. So for me, despite everything I have on my plate, Thursday, except yesterday, Thursday is my writing day. I don't do anything else except writing and thinking. All right, and I protect it as much as I can. And the only time I use it when any of my mentee have a crisis or I have to leave town, like what happened yesterday. So that's the capital. The easiest scalable capital is money. There's a lot of people who are dead and they still produce money. All right, that's like the endowments and all these kind of things. Okay, so money is the most scalable version. Then the very fragile version is social capital. I can't tell you how many friends became enemy because they neglect relationship, time and spend, and check assumptions. So social capital is very, very strong, but it's very fragile. And then there's one capital that's scariest the most. And that's the emotional, especially the negative emotion. We call it anxiety capital. That one, if you don't have the intelligence to control it, it runs like a wildfire and eat up all your other capitals. And you can manage all of these capital through, people call it EQ and SQ, or social intelligence and emotional intelligence. So then the last thing I want to let you know is this concept of the unit, the building block of Agile science, this Agile cycle. If you are familiar with quality improvement, how many people know about quality improvement? Have you heard of PDSA? Plan, do, stuff. You heard of it? Have you heard of clinical trial? These are cycle, okay? Just to let you know. But they are very different. This cycle, Agile cycle, is different on the following. This cycle doesn't run if there's no demand for you to run it, all right? So let me give you an example. Imagine in order for you to solve a problem, you have to spin, cool? And imagine you are a skater, okay? And you are really, really, really good skater, okay? And then imagine the terrain that the skater will be kind of looping on is the demand, okay? If that terrain, low demand terrain, is a hard domain like Rocky Mountain domain, how many you think spin the best gold medal skater in the world will be able to spin on a hard, rocky mountain terrain. Almost zero, and most likely if they try it, they might break some of their bone. But if you put it on an ice skate ring, then, and they have the skills and everything, they can spin very, very much. This is why a lot of change agents, they choose a battle that there's nobody else care about it, and they don't even know because they get confused between two terms. You heard of need? You heard of need, like public need, everything else? A lot of people see need and they think it's demand automatically, okay? And they are very, very different constructs. I can't tell you how much need are there for proving dementia care, okay? I haven't seen anybody who want to live in a nursing home if they have dementia. They don't want to. I'm terrified from it. But nobody care about dementia. Until now, nobody care about dementia. I can't even get a primary care clinician to spend more than 1 minute on doing something extra. I can't even convince the CFO onto doing that. There's a huge need for dementia, but there's no demand for it. Do you know what's the market demand for beer? It's a lot. Cool. And you as a public health, you see that discrepancy over and over and over. And we keep thinking about, oh, the problem is I just need to tell everybody about the need. That's not how you create the demand. You create it in a different process. And then that's one unique. The other one is the energy contribution in the Agile cycle. It's most of it, 90% of it is on doing, running the minimally viable experiment. And only 10%, it's not neglect. 10% is a big, but that 10% we plan for the first version of the minimally viable experiment or sprint, we reflect on it, and then we adjust. So that's in a nutshell our building block for Agile science to make an action. So with that, I'll give you just simple example of what minimally viable experiment is, or a chain of minimally viable experiment. And it's the following. Who has an RCT, randomized control trial? Kerry, are you running an RCT? Okay, so your RCT, when did you come up with the idea? So let's imagine 10 years just for math. So you come up with the idea 10 years. How long it took you to get funding to run the RCT? 5 years. And how long, now you got the RCT, how long it took you to complete the RCT? Recruit subject, collect the data, how much? 5 years. So your cycle, it's 20-year cycles. No, 20-year cycle, all right? 20-year cycle, the world 20 years ago, is it the same as right now? So all the information you get, it might not be relevant, okay? So this one is just simply speed that process by creating chain that will allow you to go with minimally viable solution, minimally viable experiment, minimally viable data, and then you rapidly analyze and make that decision support. Show promising, revise it again, works great, beautiful, done. You don't want to, let's just spread it, and not working, kill it. So Agile science allow you to fail as often, as early, and as cheaply. Fail non-fatally though, all right? Because if you fail fatally, there's no time for recovery. So that's in a nutshell what I mean about series of minimally viable experiments. So these are reference if you want to dig deeper, or simply email me and I'll share with you a lot. And then I'll end, I'll end with any kind of question and answer you have. It might not look like scientifically valid for you, but let's negotiate and let's fight, and I'll show you your weakness, you'll show me my weakness, and the best storyteller will win.